My cycle keeps changing every month. Is this your question? I'm asking about you watching, not the sister who asked a question, because to my understanding, there are many ladies who have the same question. So, is this your question as well? If this is your question, please say yes in the comment section. Now, there are two types of changes. That's why I actually replied this sister by asking her, what type of change are you talking about? Or explain further. Now, some people, when they talk about my cycle keeps changing every month, what you're saying is, in January, my date was different from the date in February. In February, my date was different from the date in March. In March, my date different from the date in April. If this is your worry, then largely you don't have a major issue. But there are these other people who, when they count their cycle, the length of their cycle keeps changing. If this is where you have a problem, then we might have something to explain for you, which might be much more reasonable. To the first point, ladies who have changes in the calendar date, maybe in January you mentioned on the 1st, February you see that the date is different from the 1st, and you're worried. Please, this is largely normal, and you shouldn't worry yourself unless you have counted it to know the cycle length before you now say, hey, my cycle length keeps changing. But why is it that we say calendar dates, if the dates are changing, it could be normal? Why do we say so? Here's the reason. The menstrual cycle can averagely be 21 days, which is the shortest we can have, and averagely the longest one is 35. The shortest calendar date has how many days? The shortest calendar month has 28 days, and the longest calendar month has 31 days. So can you see the disparity? Just for the fact that your menstrual cycle, the shortest you can have is 21 and the longest you can have is 35, already gives a difference in what you are supposed to have with respect to your own calendar date. So your own menstrual cycle. So the menstrual cycle in terms of the length is already different from the calendar length. This difference will make it very difficult for your menstrual cycle to always tie with the date. Very difficult, if not impossible. It's just like, let me take this example. Look at this pen. In order, if this pen is, let's say 1, 2, maybe 5 centi, if this pen is 5 centi, for example, the only way you can match this pen and make sure that the next time we measure another 5 centi is that you need to be 5 centi. But if this pen is 5 centi, you are maybe 2 centi, you will not match the length of that pen. Which therefore means, if your cycle is 28, the only month most likely that if you menstruate, it will repeat, will be February. Because February is the only month that has 28 days. So, if a woman menstruates in February 1st, she will menstruate March 1st to make her a 28-day cycle for those who have 28 days. But if your cycle is 30 days, you menstruate February 1st, you will not menstruate March 1st. It will not happen. Unless it's 29 for February that has a leap year, because we have February, which is a leap year, and it is 29 days. What about ladies with 31-day cycle? If you have a 31-day cycle, then the month you menstruate, which is 31, that next month you will also menstruate on the same date. Let's take for example, in January, if your menses is the 5th of January, you will menstruate February the 5th, if you're a 31-day cycle. It makes exactly 31 days. If you menstruate on the 1st of January, in February, your menses 1st of February, that makes exactly 31 days. Those who are 30 days, if you menstruate, June has 30 days, April has 30 days, November has 30 days. So if you menstruate this month, the date that you menstruate, if you're a 30-day cycle, the next month you will menstruate the same date. So for this reason, we don't expect ladies to menstruate on the same calendar date unless your menses, your cycle matches the length of the calendar month. If your cycle does not match the length of the calendar month, then you will not be menstruating on the same calendar day, which will be normal. There's nothing wrong with that. There's nothing wrong with that. You only have an issue if after counting this length, you realize that the length keeps changing. If the length keeps changing, that's where we now have an issue, and we'll then go to the second part to explain if the length keeps changing, where there is an issue. Let me give you a typical example. Imagine somebody who has a typical 28-day cycle in which the cycle is steadily 28, it does not change. If the person menstruates on the 1st of January, do you know when that person will menstruate again? You think it's in February? No. That person will menstruate, that's in February. 1st of January, that person will menstruate that same January the 29th. I will give the person exactly 28 days. Is it the same dates? No, but the person is still 28 days. So if the person menstruates 29 January, in February, the person will menstruate on February the 26th. The date changes, but the cycle is still exactly 28. You now see that you don't have a problem if you keep changing the dates, but the problem is you should always count and see how many day cycle will it give you. So let's go to the second point. The second point is ladies who cycles, after they have counted, the length keeps changing. Let's say you've counted from January, you have 28 days. You want to count February, it's giving you 30 days. You want to count March, it's giving you 25 days. You want to count April, it's giving you 27 days. And this is your worry. If this is your worry, then we have a discussion. If you have counted your cycle, you see that this length keeps changing. Make sure you count it for at least 5 different menstrual cycles. If the length keeps changing, please look at the shortest length you have and the longest length you have. If the shortest length you have and the longest length you have, their difference is more than 7 days. Actually, the textbook says 9 days, but generally I advise ladies to consider 7 days. If you have a difference of more than 7 days, then that cycle becomes irregular. That's why you need to consult, have a self-check. But if the length falls within 7 days, then that cycle is still okay. So somebody who cycled in January was 22 days, in February 25 days, in March is 28 days, in April 27 days. If you see, the shortest year is still 22 and the longest is 28. So between 22 to 28, what's the difference? 8 minus 2, that's 6. So this cycle is still a regular cycle. It becomes abnormal if you minus it, you see that it is more than 7 days or right up to more than 9 days. I hope this clears your doubt. I wish every lady trying to get pregnant the very best medical will make it much more easier for you. Use the number on the screen. Pay for a one-on-one session if you're interested. Don't forget to share. Don't forget to follow. Share this video so that your friend who has been confused about these stuffs. May God bless you. So have a beautiful time. Thank you.